Welcome to 52 Questions. I'm Shannon Weber, Director of HIVE. Every year, HIVE answers hundreds of questions from patients, their partners, and providers, and each week in 2018, we're bringing you one of those frequently asked questions in video format. And for this week's question, I've come to talk with Dr. Collin Smikle at Laurel Fertility Care. And this week's question is, what is the cervical cap method? And how might I choose amongst the different assisted fertility methods about which one's right for me?
Shannon, thanks for the introduction, and that's a really great question. So first, talking about the cervical cap. A cervical cap is a device that is it has a convex shape that basically the cervix fits directly into the cap. They come in different sizes. So the goal is to fit the cervix directly into the cap, and it suctions on. So therefore, the sperm can act as a reservoir, and the cervix simply just draws the sperm into the uterus, and therefore the process occurs naturally as possible. So the two parts to know is just that the cervical cap does have to be sized, because it varies from person, and it has to be positioned properly, so therefore it actually has to adhere to the cervix.
So is that something you do in the office?
So
it's not
the sizing needs to be done by a physician initially, and that's when it's prescribed. So I'm pretty sure the cervical cap is still a prescribed measurement. It's not like a diaphragm.
Okay.
Actually, the diaphragm also needs to be fitted, so it's pretty similar in terms of response. So the cervical cap allows you to basically fits to the cervix, and then it allows the sperm to be there. The cervical cap was originally used as a device to prevent pregnancies. So therefore, it fits to the cervix just like the diaphragm would fit to the vagina, and it prevents sperm from getting in. And it can be worn for much longer than a diaphragm. So, that's actually one of the things to do as well. And there's a lot of other uses for the cap. Specifically for going through measures for conceiving, the way to use a cervical cap is to, after it's fitted, to put the sperm into the cap, and then using some device, and then attach the sperm, the cap to the cervix, and then basically through a natural process with the cervix contracting, the sperm then moves from the cap into the uterus, and fertilization occurs naturally. Now, one concern in all these measures is just that not all these measures are going to be available for everyone. It's going to depend on the person's age, and it's going to depend on a lot of other parameters. Number one would actually be sperm and sperm count. So oftentimes when you're considering using it, you do need to make sure that you're starting out with a good volume of sperm to start with in the first place. And what we mean by that is also having enough sperm within the sample, so there'll be enough moving sperm that are going to get into the uterus so that fertilization can occur. Typically, under those circumstances, we want to have about 5 million moving sperm into the uterus. So wherever that starts, that's typically what you're looking at as the base measure. It can be higher, but that's the base measure. That's the approach to take.
Okay, so it's not just someone deciding what method they think they would prefer, because I can see a lot of people saying, oh, I like this method, it's the most natural. But you're saying depending on the woman's age and how many sperm are available, you have different chances of getting pregnant by the different methods, and you have to weigh that out too with how much time you have that you want to get pregnant in. And
so let me talk a little bit more time, because now we talked a little bit about the man's perspective from the sperm, or even if you're using donor sperm, that's another way to do things. But now, looking at age as a different criteria. Women, whether they're young or older, have other biological parameters that's going to interfere or enhance their chances for conceiving. Women who are younger will have a better opportunity, but they need to have normal parameters, normal plumbing, if you will. They need to have normal tube. The uterus has to be normal. They need to ovulate regularly, or you need to be taking medicines to get you to ovulate consistently, so therefore you can get pregnant. So those are the typical ways you start going through that process in terms of making a decision. As a woman gets older, the quality and number of eggs that she has diminishes, so therefore someone may consider going through and using a less aggressive method when she's younger, but as she gets older, the chances that those are going to be successful are going to be a lot less. So therefore, from that perspective, you'd want to actually look at a more aggressive approach. So using either more medicines to stimulate the ovaries, going to injectable medicines, or going on to something like in vitro fertilization. So it's not just to say you haven't tried, so therefore you should try the least costly thing. It's just that you have to look at what's going to be the best approach to maximize the amount of time you have in terms of basically being successful.
All right, super helpful. Thank you so much for joining us. Have a great week.